Good morning, everyone. I want to thank all of you for coming to this press conference today. As you know, in Sacramento, every year you hear thousands and thousands of bills. Well, this is one of those bills. It's a very simple bill. The concept is very simple, but I believe this is a very important topic that needs to be addressed. Driving, it's such an important privilege in the state of California. You know, throughout the years, we've addressed the issue of driving distracted under the influence of alcohol. Over the years, we've come to realize how serious driving is, and we know that for a split moment, if you take that attention off the wheel, tragedy can occur. And that's why over the last few decades, we've tightened up on the laws driving under the influence of alcohol. Over the last half dozen years or so, we've addressed the issue of texting and driving. And as you know, texting and driving, the bottom line is zero tolerance. If you're driving and texting, or if you're driving and speaking on that cell phone, zero tolerance. And these are good policies because I believe as Californians, we want to make sure our children, our families are safe from, heaven forbid, an accident happening out there. Today, Senate Bill 289 talks about drugged driving. Not drunk, but drugged. As you know, driving under the influence of any alcohol, of any drug, acts on the brain in ways that are totally unpredictable. And despite the ongoing efforts of traffic officers, drugged driving continues to be on the rise. And the more effectively address drug driving, the better. And that's why this bill seeks a zero tolerance when it comes to driving under the influence of any drug. With me today, I have some very important people. I'm going to start out with having Mr. Anthony Munoz, President of the California Narcotic Peace Officers Association, address this issue. Anthony.
Thank you, Senator.
Thank you.
Hi, my name is Anthony Munoz, and I'm the President of the California Narcotics Officers Association. We have over 7,000 members who are charged with the responsibility of enforcing California's substance abuse laws. The California Narcotics Officers Association is very pleased to sponsor Senate Bill 289 and wishes to thank Senator Correa for his leadership in introducing this legislation. SB 289 would literally save lives. Drug driving has increased to the point where now it is on par with that of drunk driving. Various national studies have concluded that conservatively 20% of all vehicle crashes in the United States occur because of drug driving. According to the Institute in Behavioral Health, chaired by Dr. Robert DuPont, who is a two-time drug czar under two presidents, approximately 6,700 people a year are killed in the United States because of drug driving, and another 440,000 people are injured. This level of carnage is not only unacceptable, it is completely preventable. Senate Bill 289 will reduce the drug driving body count. It's a simple yet elegant bill which basically makes it illegal to drive with a controlled substance in your system. 18 other states have adopted or have per se drug driving laws. In fact, since 1988, the nation's 10 million commercial drivers have held on to per se, have had to have per se standard for illegal drugs, which is imposed by the Federal Department of Transportation. Airline pilots and operators of interstate watercraft are also held to a per se standard. So there is absolutely no reason why we should not be holding drivers of private vehicles to the same standard. CNOA is proud to sponsor this bill and again commend Senator Correa for his leadership in introducing this legislation. Thank you.
If I can, I'd like to have Mr. Robert McCrory and the McCrory family coming up and say a few words. Mr. McCrory is with the Alameda County Sheriff's Office.
Thank you, Senator. Morning, my name is Bob McCrory. I'm a retired lieutenant from the California Highway Patrol and currently working for the Alameda County Sheriff's Office. I'd like to introduce my wife, Gina, and my daughter, Kristen Cooper. And first and foremost, I'd like to really thank Senator Correa for taking this bill on. It's a very personal issue for me and my family, and I can't thank the Senator enough. Thank you. What initiated the thought process behind this bill was, as I said, I was a member of the Highway Patrol, and my son joined the Highway Patrol a few years ago, honoring me and my family. Unfortunately, in 2010, he was killed on duty while on a traffic stop by a person who was under the influence of marijuana. To add even more insult to that was during the trial that occurred approximately 2 years later, the jury was unable to come to a conclusion whether he was under the influence, even after having overwhelming amount of evidence to show that he was under the influence. It occurred to me that the current laws in California are just not adequate to prosecute drug drivers. Perhaps marijuana or perhaps the alcohol laws are effective, but absolutely not the drug driving laws. So this coalition has been initiated to help tighten up the laws that need to help us prosecute drug drivers. And again, I'd like to thank Senator Correa and the entire coalition, some of which is standing behind me. This is very exciting for me and my family, and I thank you all for being here. Thank you.
Ken, I'd like to have Mr. Scott Seaman, President of the California Police Chiefs Association, also say a few words.
Senator, thank you so much for your leadership. Leadership to the point that this year the California Police Chiefs Association, who represents 78% of California's residents, is honoring Senator Correa as its Legislator of the Year at our annual summit, annual conference in Palm Springs next week. Senator, it's a privilege to be able to recognize you this way and to thank you specifically in close timing to the introduction of this bill. California's law enforcement leaders, and I join with those sheriffs and the California Highway Patrol, among other public safety and law enforcement leaders who have created a very strong coalition to address a problem that we well recognize and which you have heard described for its impact. As we think about where we are in the law with driving under the influence of alcohol and the natural assumption that we have that is correct public policy to keep our youth, our families, our residents safe and free from irresponsible driving, it is very difficult for law enforcement and for prosecutors to understand why we don't have the same view around the impacts of drug driving. What we're dealing with is impairment, and drugs create impairment, as does alcohol. Both are drugs on the body. Law enforcement and prosecutors currently lack sufficient tools to address the entire continuum of impairments which our public faces. And it's for that reason that this year California Police Chiefs Association stands strong with our partners in law enforcement and public safety and in the broader community to call for action for our state to set standards to control the impacts of drugged driving. We know that this is an area of learning for the public to understand the impacts, and I represent, on behalf of California Police Chiefs, that this is a critical need in our communities, and we're prepared to work hard to help keep our community and our state safe. Thank you, Senator.
Thank you. I'd like to introduce Mr. Scott Jones, Sheriff's Department, Sacramento County.
Thank you, Senator. Good morning. I represent not only the 1.4 million people in Sacramento County for whom I am charged with protecting their safety, but I'm here also on behalf of the California State Sheriff's Association, representing all 58 sheriffs of each county in California. Drugged driving, although it started perhaps as an anecdotal footnote to the more awareness of drunk driving, has become just as pervasive a problem, and in fact, in some studies, a more pervasive problem than drunk driving. You might think commonsensically that there are laws in place that prevent drug driving or driving under the influence of drugs, and while that's technically true, the difficulty of enforcement, the lack of objective criteria for which we can make arrest and successfully prosecute such cases has been difficult and almost non-existent to this point. With this bill, this will give us the objectivity to not only enforce, but prosecute these cases as well and help further protect those folks on the road that rely on us to preserve their safety as they travel down the roadways of California. I want to thank Senator Correa for his leadership in tackling this important issue and let him know and all of you know that all of California law enforcement stands strong in support of this bill. So thank you.
Thank you, sir.
And our last speaker, Bishop Ron Allen, President and CEO of the International Faith-Based Coalition. Bishop.
Thank you, Senator Correa. My name is Bishop Ron Allen. I'm the CEO and President of the International Faith-Based Coalition. This bill is important to us, all 4,500 faith-based houses. We are tired of presiding over funerals year in and year out, caused by a problem that we believe can be rectified by SB 289. Our kids are not just collateral damage. Our kids are somebody's baby, somebody's young daughter, somebody's young son. And to look in that coffin and to know that this problem is a steady problem year in and year out because someone decided that they're going to drive under the influence of drugs. We stand strongly, we stand powerfully with Senator Correa and SB 289, hoping that one day we will not bury so many of our children because somebody decided to get behind the wheel and drive under the influence of drugs. Thank you so very much, Senator Correa. We stand behind you, sir.
Thank you, Bishop. Thank you.
Let me briefly conclude by saying to all of you that I know there probably be some opposition to this measure, but let me clearly state to you that if you have your medical marijuana prescription and you're at home medicating, this bill has nothing to do with you. This is merely a bill that says if you're out and are going to get under the influence of any drug and you decide to drive, then this bill has everything to do with you. This is about keeping our streets safe, about keeping our families safe. It took us decades to pound into people that you should not drink and drive, that it is dangerous to drink and drive. Then we started talking about texting and talking on the phone and driving. And today, this is about being drugged and driving. We'll open it up for questions. Thank you.
Senator, so you're exempting people with a prescription? So
that's correct. If you have a medical prescription and you're driving, okay, essentially you won't have the issue of, having this fall as a crime, so to speak, as breaking the law. But let me be clear that even though you may have a legal prescription on you and you're under the influence of that medication when you're driving, if you still get into an accident, you still will have major civil liability.
Well, yeah, I mean, what makes people with a prescription safer drivers than people without? I mean, you're under the influence, period.
You shouldn't. You should not be driving under the influence of any medication. But nonetheless, under the laws, if you have a prescription, okay, you shouldn't be driving, but if you have a prescription, you're legally taking your medication.
There's a .08 limit for drinking and driving. You guys chose to go for the zero tolerance approach. Why that as opposed to, a small amount?
We want to send a clear message that any level of being drugged is dangerous when driving. So the level should be zero tolerance. And of course, that also is key to the prosecution here, because right now, under the present state of the law, it is very difficult to prosecute individuals. As the McCrory family said, you had a horrible death in their family, and because of the current state of the laws, prosecution and conviction was very difficult.
Can you elaborate more on why it's so difficult? Just maybe a law enforcement person can just detecting when someone is drug driving.
The difficulty now, and as I mentioned in my comments, that driving under the influence of drugs, impaired driving, so to speak, is currently illegal. The difficulty is also the strength of driving under the influence in the .08 standard. The strength of the .08 prosecution is because it's a very objective test, because the legislature and experts have agreed that .08 for blood alcohol content constitutes impaired driving under the law. When you're prosecuted for drunk driving, you can get it prosecuted for having a .08 blood alcohol content or greater and for driving under the influence of alcohol. There's two separate crimes. The difficulty in drugged driving is there's no objective test to say this level of drugs is not only impaired driving, but this level of drugs shows you under the influence. Because as we know, the remnants or the presence of drugs can stay in your system long after the physical effects are felt. So you could be not under the influence of drugs, still have drugs in your system, and there's varying levels for the different drugs which lend themselves to that. Some drugs stay in your system longer. So the difficulty in the different kinds of drugs and the presence of them long after the impairment may be gone creates almost an impossibility or a built-in defense, legal defense, to driving under the influence. That's why for drug driving, unlike drunk driving, the limit has to be 0. That's the only way to successfully have an objective standard that can be successfly prosecuted.
So what are the consequences? Is it spelled out anywhere? Or you say 0 tolerance, and then what happens? Like your license gets taken away, or you're in jail? What?
Well, maybe you can speak to the consequences that happen immediately, but it would be very similar, on par with a drunk driving. So there would be action against your license, there would be criminal prosecution, and criminal sanctions if there were successful prosecution.
Treatment programs.
And treatment, exactly right.
But the most important message to take away with is don't be drugged in driving. This is going to be an ongoing effort to educate society to not be drugged and to drive.
I know you mentioned marijuana, but I mean, could you talk a little bit more about other drugs that were in mind when this bill was drafted under this section?
Because you could have a prescription for marijuana.
Right.
No, it's a recommendation.
Oh.
Many drugs affect a person's impairment. And police officers and sheriffs and highway patrol routinely deal with people who are under the influence of not only marijuana, but cocaine and methamphetamine and PCP. I think the critical understanding that people should reach is what will trigger the stopping of an individual and the testing and the prosecution of an individual for this. It will be based on some indication, either an accident, very erratic driving, the same kinds of things that police officers see. And so I believe that impairment will be obvious as we start to deal with these situations on the street as this law comes into effect, and therefore there needs to be a test or some method to evaluate whether or not the person has drugs in their system. And the drugs that are called out are those that are already illegal to both use and possess, and certainly to drive while impaired.
Last question. You talked about you expect opposition, presumably from maybe some medical marijuana groups. Do you expect other opposition?
I would imagine so. This is, I believe, very much of a groundbreaking piece of legislation. And so I believe, like any other legislation that is critical, that really changes the way people think, that there will be major opposition to this bill.
From whom?
I'm sure there'll be opposition from numerous groups. But we have to make sure that we understand what we're trying to do here, okay? A very simple concept of it is dangerous to text and drive. And the data's coming in that texting and driving results in horrific accidents. What we're trying to do here is change the way people think, and for folks to understand that being drugged and driving is also very, very dangerous. Just don't do it. 0 tolerance.
I just offer another way to talk about opposition is who is in fact supporting this. And Mothers Against Drunk Driving, the Faith-Based Coalition, I think are two great examples of non-law enforcement public safety partners who have stood with us, and we know that others will join. I well anticipate that people in the medical field, people in the education field will recognize that the safety of our youth particularly and the safety of our communities is paramount, and that neighborhood organizations, cities and county governments, residential groups will see this as a great value to increase the safety of our roadways and our communities.
Do other states do this?
Yes.
Which 18 other states. Thank you very much.